The practice of medicine has always been a delicate dance between prevention and reaction. For centuries, medical professionals have strived to find the perfect balance, ensuring that patients receive the best possible care. For years, the emphasis leaned towards prevention. This approach was rooted in the belief that preventing illness was far more effective and less costly than treating it after it had developed. Doctors urged regular checkups, screenings, and early interventions to catch problems before they became severe. They believed that early detection could save lives and reduce the burden on healthcare systems. This proactive approach aimed to keep people healthy and out of the hospital. It encouraged individuals to take charge of their health through lifestyle changes, regular exercise, and a balanced diet. But in recent decades, a noticeable shift has occurred. The healthcare landscape has changed dramatically, influenced by various factors including economic pressures and advancements in medical technology. The focus has tilted towards a reactive model of care. This means that instead of preventing illnesses, the system is more geared towards treating them once they have already developed. Patients often struggle to access basic diagnostic tests and treatments. Long wait times, bureaucratic hurdles, and high costs have made it difficult for many to get the care they need in a timely manner. Insurance companies, rather than medical professionals, often dictate the course of treatment. This has led to a situation where financial considerations sometimes take precedence over patient care. This shift has left many patients feeling lost and frustrated, struggling to navigate a system that seems to prioritize profits over their well-being. The challenge now is to find a way to restore the balance between prevention and reaction, ensuring that patients receive comprehensive and compassionate care. Preventative care was once the cornerstone of a healthy society. Regular checkups allowed doctors to monitor patients' health, identify potential issues early on, and intervene with lifestyle changes or medications before conditions worsened. This approach not only improved health outcomes but also reduced the overall cost of healthcare. Early detection often meant simpler, less invasive treatments. It allowed individuals to take control of their health, manage chronic conditions, and live longer, healthier lives. The focus on prevention created a system where patients felt empowered and supported. It fostered a stronger doctor-patient relationship built on trust and open communication. The shift towards reactive care has created significant obstacles for patients. Obtaining approval for even basic diagnostic tests often requires navigating a labyrinthine bureaucracy. Insurance companies, driven by profit margins, frequently deny claims or delay approvals. This delay in treatment can have devastating consequences, allowing illnesses to progress and become more complex and costly to treat. Patients often find themselves caught in a frustrating cycle of fighting for the care they need. This reactive approach not only impacts individual health, but also places a greater strain on the entire healthcare system. The role of insurance companies in the healthcare system has come under intense scrutiny. While their primary function is to provide financial protection against the cost of illness, their focus on profit maximization has raised serious ethical concerns. Denying necessary treatments to save money directly contradicts the fundamental principle of healthcare to prioritize patient well-being. This conflict of interest creates a system where financial considerations often outweigh medical necessity. Many argue that insurance companies, entrusted with the health of millions, should be held to a higher ethical standard. The question remains, can a system designed for profit also prioritize the well-being of its patients? The consequences of a reactive healthcare system are most acutely felt by those battling chronic or severe illnesses. The delay or denial of necessary treatments can lead to worsening symptoms, increased hospitalizations, and a diminished quality of life. The financial burden of high medical bills, coupled with the emotional stress of fighting for coverage, takes a heavy toll on patients and their families. This situation can feel hopeless, particularly for those already grappling with serious health challenges. The current system often leaves the most vulnerable patients feeling abandoned and betrayed by the very institutions designed to protect them. Section 6. Navigating the system: Consumer Rights and Appeals. While the current system may seem daunting, patients do have rights. The Affordable Care Act mandates that health plans provide a fair and transparent appeals process for denied claims. Patients have the right to appeal a denial and request a review by an independent third party. While this process offers a glimmer of hope, it can be incredibly complex and time-consuming. Navigating the appeals process requires persistence, organization, and often legal assistance. It's a system that often favors those with the resources and know-how to navigate its complexities, leaving many vulnerable patients at a disadvantage. Section 7. The need for oversight. Can the government do more? The growing dissatisfaction with the current state of healthcare has fueled calls for increased government intervention. Many argue that stricter regulations are needed to ensure that insurance companies prioritize patient care over profits. Proposals include measures to increase transparency in insurance policies, limit out-of-pocket expenses, and provide greater oversight of the appeals process. Some advocate for a single-payer healthcare system, believing that removing the profit motive from healthcare is the only way to ensure equitable and affordable care for all. The debate over the role of government in healthcare remains complex and contentious. Section 8. A tragedy in Midtown, the murder of Brian Thompson. This shocking event has sent ripples through the community, leaving many to question the state of our healthcare system and the lengths to which people will go when pushed to their limits. The simmering tension surrounding the healthcare system reached a boiling point with the murder of United Healthcare CEO Brian Thompson. For years, patients have voiced their frustrations, but this incident has brought those grievances to a tragic head. Thompson was killed outside a Manhattan hotel following a United Healthcare investors meeting. The location, a symbol of corporate power, only added to the gravity of the situation. The suspect, a young man struggling with chronic pain and mounting medical debt, allegedly targeted Thompson as a symbol of a healthcare system that he believed had failed him. His story is one of many, reflecting the broader crisis affecting countless individuals. This tragic event, while an extreme example, highlights the desperation and anger felt by many struggling to afford the care they need. Families are torn apart, and lives are disrupted as people grapple with the financial and emotional toll of inadequate healthcare. It underscores the urgent need for meaningful reform and a renewed focus on patient well-being. The call for change has never been louder, and this incident serves as a stark reminder of the human cost of a broken system. The hope is that this tragedy will catalyze real, lasting improvements in healthcare. Section 9. A call for change towards a more humane healthcare system. The current state of healthcare in America is at a crossroads. With rising costs and increasing patient dissatisfaction, the need for a transformative change has never been more urgent. The shift towards reactive care, driven by profit motives, has created a system that often fails those it is meant to serve. Patients are burdened with exorbitant medical bills, and the quality of care is compromised. The tragic murder of Brian Thompson serves as a stark reminder of the human cost of this broken system. His story is not an isolated incident but a reflection of the systemic issues that plague our healthcare. Moving forward requires a fundamental shift in priorities. We need to reimagine a healthcare system that places the well-being of patients at its core. We must move away from a system that prioritizes profits over patients and towards one that values compassion, accessibility, and quality care for all. This means investing in primary care and mental health services, ensuring that every individual receives the care they need. This requires a multifaceted approach, including stricter government regulations, to ensure that healthcare providers and insurance companies are held accountable. Increased transparency from insurance providers is essential, so patients understand what they are paying for and can make informed decisions about their care. Additionally, a renewed focus on preventative care can help reduce the incidence of chronic diseases and improve overall public health. Most importantly, it requires a fundamental shift in perspective, recognizing that access to healthcare is a basic human right, not a privilege. By coming together as a society, we can build a more humane healthcare system that serves everyone, regardless of their socioeconomic status. The time for change is now.